I am so excited. That would be episode 4 that I did not mess up with our intro. So for those keeping count on In the Hot Seat, we can stop making fun of me because I think I finally got it right.
I think you've earned your wings now. Congratulations.
I have. I've graduated. I've made big time now. I'm very excited. Hey, everyone. Thank you so much for joining us and welcome to In the Hot Seat. For those of you that are repeat viewers, you have seen in the past where we come on with big wide eyes because I always mess that up. So I'm on a streak and we're going to fix that moving forward. If you are new to the show, sometimes there might be a little glitch on LinkedIn. If you find yourself into this repeat pattern, you may just want to refresh the screen or go over to one of our other channels and join the show. This episode is really exciting. For those of you who have been following our series, we have been doing some pretty interesting episodes on privacy and security. And I got to be honest, before we engaged in this series, Kristy, I really thought, I got this. I'm good. I so know everything I need to know about security. And then we're doing this security series, and I'm like, oh my gosh, I want to get rid of every device. No. So, So why don't you tell us who we have on today?
Well, today, and this show is really special to me, I have to say. We have Heather Lavoie today. Heather is just always been a mentor of mine. I used to work for Genea, where she was CEO. She has been a mentor. She has been a friend. She has been an inspiration. And talking to her about any topic, especially when it's healthcare related, you just get such a wealth of information, and you can just see how incredibly brilliant she is. So I am very excited. On today's show, we have Heather Lavoie, CEO of Illume Advisors. Heather is a strategist, a serial entrepreneur, and a startup advisor. Heather spent the last 20 years of a 35-year career founding and leading technology services organizations that solve complex issues in healthcare and society. Prior to founding Illume, she was CEO of Genea, a healthcare analytics organization. Her clients span health plan, hospital, provider, and technology organizations. Heather is current board chair of the New Hampshire Tech Alliance, on the board of advisors for UNH Manchester, and is past chair of the board of Granite United Way.
So totally qualified to talk about our topic today, right? The biometrics. Absolutely. And, when you give up that information, like, what's the benefit and where do we want to be a little cautious, right? I know you had an interesting scenario this weekend, so we were chatting back and forth offline about. You want to talk about that one?
I never can get my 10,000 steps in. It's my goal every day to get my 10,000 steps in. Never happens. And I look at my watch and I have the little rings, right? But that doesn't tell me how far into my step count I am. And I have my phone, but there's nothing there that just shows me steps. So I decided I'm going to go out and download Pedometer Plus Plus. And it's got a great little widget for my iPhone. And it's got a little complication down here that shows me how my progress is. And as I'm going through and installing it, it's asking me for my permission to connect to Apple Health, to, collect my personal data. And I'm like, oh, after that conversation with Heather, I don't know. I don't know if I want to allow this. Like, am I really that lazy? I can't just click on my little thing and see how far into it I am.
After every episode this series, those terms and conditions come up, and I'm now like, I got to spend the next 3 hours reading it to make sure I'm not giving away my entire life history.
Well, I thought it was fascinating in doing some research for this, right? Beyond Trust noted that there's one notorious instance in recent years of a consumer product playing loose with data privacy concerns, and that involved VTech's popular My Friend Kayla talking doll. So apparently my friend Kayla uses voice recognition software, and that's embedded and enabled with Bluetooth. And apparently it collects and receives data on the device. And it has no privacy standards in many countries. It doesn't have none. in many countries, it violated the privacy standards and they never checked on that. So there's one writer out there apparently that said that Kayla, the connected doll, is a spy that must be destroyed. So just when you thought you didn't want Alexa or the little Google Pod in your home anymore, you probably don't want Kayla either.
Clearly, right? Let's just get that list of all of the things that we don't want. Can we just go back to analog and like dial-up
Right.
rotary and I don't know.
The doll that sneezes. I don't know.
Yes.
Yeah.
I think we should maybe bring in Heather and see what she has to say about this, because I really want to understand. I want to understand what I'm giving up and why.
Absolutely.
Right? Heather, welcome. Thank you for joining us.
Thanks, both of you, for inviting me today.
Oh, this is going to be so exciting. As I don't know if you heard when we were kind of bantering back and forth, but after our pre-show, I have to tell you, I went out and I'm like, this is ridiculous. I want to get rid of every wearable. I want to get rid of I just want to get rid of everything. So, Heather, can you kind of let's set the groundwork for everyone, right? Like, what is the biometrics and the data that we're collecting so we can level set and understand what we're talking about today?
Sure. So there's so many different devices. Apple Watch is a great example of a device that now is capturing data about, your steps. It might be capturing data about, your pulse. You may have, frequent user. I have a Garmin watch. And so my Garmin watch, I use it to track all my workouts, not just steps, but any other workouts. And it's capturing information about my heart rate. I have an Oura ring on my finger, my index finger I'm sticking up. And that captures information about my sleep. It captures information about heart rate variability. So it's looking at pulse information. So we're capturing a lot of this data off of different devices that we have. People have neural, devices now that they're using to sort of capture, kind of brainwave information in sleep. People track on different devices how much water they've had. They're tracking nutrition information. Sometimes they're scanning food information for caloric intake calculations. And so all of that is certainly, getting captured to devices, but then obviously shared up in the cloud and across all different vendors, depending upon, which software technology company, product company is really capturing all this information. And that's just consumer wearables. There's a whole range of FDA approved devices where you may have, your blood pressure being captured on a device now. You might have a spirometer that's where people are actually using it to look at breathing. Glucometers, so you're checking your blood glucose levels, and that's getting captured and submitted over. There's SpO2 monitors, so it's looking at the oxygen, sort of the blood oxygen level, to see, particularly for people that have breathing difficulties or might be on supplemental oxygen. And so there's a whole range of additional devices that are capturing even more specific biometric information. So FDA approved devices as well as then consumer devices, and there's sort of a bright line that sits in between both of those.
Okay, that's a lot of information, and I do most of what you said. I have my little bottle here that lights up blue when I have not had enough to drink, and tracks on my phone. And so, yeah, I'm one of those people. So, so what happens to the data from there? Like, where does it go, and how do other people use it? Like, can my healthcare company see that and say, "Oh no, I don't want to insure her"? Can my life insurance company or Experian, who sees that, and does that impact me?
So first question is where does it get stored? And so it's stored directly, typically on the device itself. So I'm pointing to my Oura ring right now, but then gets typically transmitted up into the cloud. And so usually you're transmitting it via Bluetooth, or you might actually plug it in to transmit it. So it's stored in the cloud. It's stored with that company, whoever that company might be. They might also share it depending upon the user agreements that the terms and conditions and user agreement that you signed or authorized when you loaded up the device. That gives them permission to store and as well as reshare that data out to other companies as well. So it can be, passed along to a lot of different places. Good example of that. So I have a Garmin watch, collects all my data. I like to share that data to Strava. I like to share that data to Training Peaks because I have a coach that monitors sort of my workouts. And so that information can be shared with her. So I can share it in a few different places. It also asks me if I want to share it to Facebook. I do not. So it allows me by the other sites to expressly authorize and deauthorize that information. It defaults to none of them. And then I can expressly decide to share it to different places. So every company is different in terms of how they manage their terms and conditions and how they store and reshare your information. It varies from organization to organization. Healthcare companies, so health insurers, cannot use that information for rating purposes. And that's not to say they couldn't in the past. There used to be individual medical underwriting, but that doesn't exist anymore. So that's not used for rating. Your information, depending upon the application, it could be shared with your insurer. Many insurers offer a whole range of services now for tracking information. They might even incent you to exercise, to track your food intake, to perform certain healthy activities, and they might provide gift cards and other incentives, discounts, maybe off of insurance at an employer site if you do certain activities. And so sometimes they can receive that and they use that information for care management purposes to identify risk, to make sure that they're caring for you properly, but they can't use it to change to increase the price of your insurance. So that isn't allowed from a health insurance perspective. And there's a lot of rules around what they can and can't do with information and how it can be shared or not shared once it sits in a health plan wall. HIPAA regulations actually describe how they have to protect that information on your behalf. For other, just commercial vendors, any type of software company, they can resell your information if you, allow them to under their terms and conditions. So I guess in the example before I entered in, I could hear you from the green room about the doll. Well, in that case, it could be that they freely shared that information about you, whatever they captured, to whomever they want. And that could be for credit rating purposes. It could be picked up, in other ways and to assess your risk from a life insurance perspective. That information, certainly could be passed along if that organization chooses to do so. So it is important. Unfortunately, it's a lot of legalese, right? And so none of us really want to go through the trouble. To your point, you just want to load up the app. And it's a conversation I have a lot with my kids. I say I'm not very fruitful, but I, refuse to load up TikTok. And because there's, real privacy sharing concerns that I have. There are other apps that I've been able to investigate, and I have less concerns from a privacy sharing perspective. So it is important to, look at the app, think about it, think about the company, understand what they may or may not do. And because it's not always easy to discern from the terms and conditions. So doing some background investigation first is really important.
Wow, Jody, I think every guest we've had has referenced those terms and conditions that nobody reads and really should.
No,
I think like literally in this whole series, everybody has talked about that.
No, because you pull them up and you're like, I'm just going to scroll through. Right. Yeah, you know what? I want the app. I'm going to click. And then before you know it, suddenly I have agreed that all of my information could be sold or third party, and ads are bidding on me as an individual. And Heather, you were just talking about it from an individuality standpoint. And it brings up the question, is this data in any way being also anonymized so that groups can have particular efforts around improving healthcare outcomes, right? So collecting this data, trying to really understand this sample set of like individuals, and then applying some intelligence behind it to try and figure out, how can we improve health outcomes for this particular region or geographic location, if it's something related to air quality. Or I mean, it just got me thinking about, how this information could be used in a positive way.
Yeah,
versus the negative that we're talking.
Yeah, it absolutely is. Certainly, it's used by research organizations. Can get license it on an anonymized basis. Health plans certainly look at this information, and they on a de-identified and on an identified basis to take a look at, in exactly to your point, where are their health risks present, what sort of from a multifactorial perspective, how many of these come together that then can cause disease onset or disease progression, so that you can identify people earlier. But there's certainly more and more even ambient monitoring. I was going through the airports the other day and thinking about sort of COVID, resurgence that's happening, and they're starting to do more sort of ambient air monitoring in airports to look at whether sort of the rates are increasing in terms of the presence of particulates. So, important ways that you can look at some of this data. Now, that's obviously not streaming off of a device from me, a little bit different scenario, but the data itself that is coming in certainly can be used in that way. And I've always found this to be such an important area that is still emerging in terms of use of AI and investigation. There's so much that goes into disease onset and disease progression, and it has to do with sort of gene expression being turned on and off. And it's, it's so difficult to hone in on any individual factor, because I might live the exact same lifestyle as someone else. And yet I might get cancer and they might not. And it's because our genetic makeup is so different, because the pollutants in the air around us are so different, because our levels of stress are so different, and how our body turns on or off based on loads of stress. That can determine whether we may or may not get a disease. And if we were able to identify that earlier, you can change conditions in order to be able to impact that sooner, which would be wonderful to be able to do. It's hard to do that. The volume of data that comes off of these devices streaming is just more than sort of a human can consume and make their way through. And so that's where the use of AI can be of particular assistance, and because training it on the vast volumes of data, taking a look at sort of genetic composition, as well as all of these then biometric data that come in, and comparing the two, you could look for basically any type of patterning, look at correlation, look at what distill down what range of factors come together that then in a population actually show sort of disease onset or progression. It's still relatively new. There's places that are doing much more of it. Actually, Mount Sinai is one area where they're focused on exposomics. And so they're looking at environmental factors, and they're looking at your genome and taking a look at the correlation between the two. They're actually using wearables to draw some of those correlations. So they're one place that's doing really innovative breakthrough research. They're actually even using, it's not a wearable, but they're using hair samples from newborns, and they're looking at also teeth, and looking able to actually predict autism in children from factors there. So there's all different ways that you can use some of this biometric information, whether through a device or otherwise, to be able to predict onset of disease. So bold new world that we're entering into, but obviously there's lots of guardrails that we have to put around protecting the data, protecting the people, and then also responsible and ethical use of AI.
Wow. Like
Sorry,
that.
that was a lot.
No, that's good though. And it's fascinating. And so I'm thinking back to our days at Genea and all of the data that we tried to collect and put in one place and combine to use, the claim data, any of the clinical management data, all of the stuff that we had coming in and we're trying to use to do exactly some of this. That was only what, not even 5 years ago, 3 years ago. And there's now so much more out there. I can't believe that went that fast. And I just, is there anything out there now that collects all of that and synthesizes it somewhere? Or is
I
it
think
still in a bunch of different databases?
Yeah, it's still on a lot of different databases. I think, not to sort of over focus on the terms and conditions, but I think, the terms and conditions, a lot of these apps are important because the data is valuable. It's valuable to a lot of different people. And so, yeah, for good purposes. And so the resale of that data, the marketing of that data on a de-identified basis, to your point, Jody, is really valuable to do some of the research. Oftentimes you can, use these sort of, large sources of data, apply AI on it, find the individual factors, and then you can build basic algorithms thereafter, because you can say, if you have certain lactate levels and you have this blood pressure and you have this other factor and you have this other factor, then someone may progress on to have sepsis. And that's like a good example of, when we were early on at Genea, we partnered with Lockheed, and they were using, Mike Drugalis was there at the time, and he worked on the missile defense system and signaling technology. And he applied that same logic to look at prediction for sepsis. He happened to be in like a Chamber of Commerce meeting, and they were talking about the challenge of sepsis. And you have just such a short amount of time to identify someone that may be septic. And so he applied sort of signaling, that same thing that you do from the missile defense system, to make, assess incoming. Is this a barbecue grill, or is this an incoming missile? And using that technology to then do sort of earlier and more accurate prediction on sepsis. So there's places that are applying it, but there's not sort of one place that you can get all of this referential data. But once you can mine through that data, then you can set up some basic algorithms to use for prediction thereafter. And so a lot of people benefit from the after it's been figured out and it's a basic algorithm, a predictive algorithm, then people might license those. But not a lot of people are in the business of sort of mining through the vast stores of data, because it's a lot to acquire, it's a lot to store, it's a lot to manage. You need, highly trained and specialized people to mine through it. But there's certainly lots of activity going on all over the country.
So you kind of started going down a path that I was just thinking about with the healthcare, right? With like healthcare, I was thinking about it in terms of healthcare costs, like opportunities to help us better manage healthcare costs that are spiraling out of control, being a little bit more proactive. But before I go down that path, I want to come back a little bit and talk about the leveraging that data to be proactive in diagnosis. And I was just thinking about something, right? All of these personal devices that we have, those all have their individual terms and conditions, right? Nothing's really hooked to me as a person for my healthcare. It's in my healthcare, in my, whatever Epic system that I'm logging into for my patient portal. This data is not going there. Do you see a time in the near future where there's more synergy between individuals like myself saying, I want to hook this into my healthcare record so that my provider is getting a better view? I mean, is that something that's, our future state?
It's a current state, actually. There are many, many, many hospitals around the country that already integrate with the Apple Watch. And so you can actually decide to allow your data to flow through into your clinical record. So many hospitals have been signing on to take that data in. I will say that typically they're the more sophisticated hospitals, and not necessarily because the integration requires a lot of sophistication. It's work and it's cost. But there's an obligation once they're consuming that information. There's an obligation that if for some reason there is there's something alarming, that they're taking action on it, and so there's a concern about malpractice if in fact you're transmitting information and they don't act on it right away. And I will say that with many of the devices, and even the FDA approved devices, there's a fairly wide threshold for accuracy. Which means you get a lot of bad readings, and you'll see in, like in Garmin groups and things, people say, boy, my heart rate was clearly off. It wasn't capturing that. Many wrist-based heart rate monitors it's just known that they're not that accurate. Chest straps are more accurate, but there's still, even FDA approved SpO2 monitors for your blood oxygen level oftentimes give bad readings. If the batteries are starting to wane, people that work with patients that are using them, you will often say, hey, change out the batteries, because sometimes just the battery going down causes them to throw off bad signals. So there's a lot of noise with some of this. So there's also the concern that I'm going to get a whole lot of false positives, and that gets into the clinical record. And then what do we do about that? So you really need a sophisticated governance model and some type of monitoring. It doesn't have to be the physician, but some sort of, clinical monitoring for when bad results come in, that you're taking action, you're making sure that the patient understands and that there's something that's pursued. So you do need a certain degree of organizational capacity to be able to do that. But many hospitals around the country integrated with Apple. And then there's other organizations. There's a great company that I've been following for a long time now, over a decade, called Validic, VALIDIC. And they are an aggregator of all sorts of consumer wearables, but also FDA approved devices. So they integrate with like everyone, and they have many connections with integrated delivery systems, hospital systems, where they're bringing consumer wearable and as well as FDA approved devices together, and they're bringing it into the medical record so that it's actually part of the clinical record. So it really depends on the site of care, but it is very customary now for that information to be actually consumed and transmitted. Same, you still, depending upon the device, you provide authorization or not for that to be sent in, but it is a benefit to patients.
So thinking back to that previous life we had, we used to have devices that we could send into the home, right? And we had a big focus for a while on remote monitoring. Is that still a thing? And is that progressed to the point where now, instead of those big bag devices that we used to send out, could we send a watch, or could we have sent a ring or something like that? And, how would they get some of that, have those devices? Because, we're not around anymore. I'm sure there are other companies that do that kind of stuff, but.
Yeah, so many health plans, some of them will send out consumer wearables, and that's part of some of the benefit plan design. And that might be for people that are sort of lower acuity, healthy, they want to keep them healthy, and they see that there's a cost benefit to providing some of that out as incentives for their membership. And then there's others where you have people that now are chronically ill and are very complex, and you want to monitor them in the home. An increasing number of hospital systems are doing it. Certainly the visiting nurses, the home health agencies are definitely providing this now. Typically, they're not providing consumer wearable devices. They're providing FDA approved devices because that's what's required to get reimbursement from like the health plan or from Medicare for the services. So if you're doing the monitoring, you're to get credit, typically it has to be an FDA approved device, and because they will obviously want clinical accuracy. And so they'll be looking to do something like that. And then there's, beyond just monitoring patients in the home, there is an entirely new movement to manage, basically it's called hospital at home, and where you're actually taking someone that could have been inpatient and doing almost a home telemetry unit. And so it's much more sophisticated in terms of the devices in the home, how they're monitoring. It's just like an inpatient stay. A doctor or a nurse practitioner will round on that patient every single day and monitor them. So there's someone that they're clinically cleared to be in the home and have those services in the home and be monitored at a more intensive level. It pays just like you would pay for a hospital stay in terms of sort of the reimbursement but they're seeing that patients are safer, they recover faster, they get to being mobile, getting back to their active daily living activities more quickly when they actually convalesce in the home than if they're doing it in an inpatient facility. So you're much more comfortable getting up and going to the bathroom in your own house than you might be getting out of a hospital bed and sliding across the floor. And so they're doing more and more sophisticated, devices and units that can now be deployed to the home for monitoring for really complex, for like skilled nursing in the home. Certainly there's home dialysis that happens now. So there's a whole range of services because we have much more sophisticated devices that can be deployed remotely that you can get many more services in the home.
Wow.
That's really interesting, the scenarios that you just talked about with hospital and home, because I was thinking when COVID happened, right? When we all remember doing the virtual doctor visits and you had to do you had your oximeter, like is that what it's called? The oximeter, where it does your pulse? Yes. Okay.
Yeah.
So you had all these devices and you would report your stats to the doctor via a Zoom, or not a Zoom call, but a medically approved Zoom call. And at that time, I was joking around with my husband, being like, can you imagine a day where like you don't go to the doctor or you don't go to the hospital because you're doing it at home? I mean, that's kind of the world we're creeping into. And here we are today. We're there.
And there's a benefit.
And scary.
Yeah. Well, you can think about, so you can imagine if I am, I might be elderly, but I have well-controlled blood pressure. It used to be that I had to go into an office every 3 months to have a blood pressure check. Well, if I'm well-controlled, that's pretty low value. And in fact, if I'm elderly, I could have transportation barriers. And so I might not have easy access to a ride. And then when I get to the doctor's office, there's other sick people in that waiting room. And now I'm exposed in a way that I wouldn't have been exposed when I could have just transmitted a blood pressure reading and had, an easy nurse televisit. And so it definitely keeps people who might be medically compromised in a much better setting of care and monitored more effectively. And look, we have, I've been saying this for so many years, but there's 10,000 people that turn age 65 every day. And we don't have enough caregivers for people aging into, sort of more, complex end of life medical needs. And so we have to be creative about the way we provide care. It's not just about cost of care. Cost of care is important, but it's also because we just don't have enough caregivers. We have a shortage of clinically trained individuals or even lay people that can provide care. So being creative about the sites of care and the methods of care is really going to be important going forward.
I'm still stuck on that stat, 10,000 people turning 65 every day. Like, you stopped me on that one. I was like, wait a minute. That's a large number. So a question, because as you were, again, talking about these scenarios, just thought of another question. And this is kind of a little bit far out there, but follow my thought process on this. The company that you said gathers all of this data from the wearables, right? And they're able to sell this data. Does this company also purchase data from, say, loyalty programs, right? And so where I'm going with this, like a grocery store, is there a scenario where someone is able to take my data that I have from a healthcare perspective and marry it up with, say, like my grocery habits or what I'm buying to be able to make, right, some inferences there and how that impacts my insurance costs? Or, well, you mentioned before take insurance out of the mix, but my future state and some of my factors that might cause future, health problems, or if I'm like I'm eating awesome, so therefore I am the picture of health. I mean, is that a scenario that exists, or am I just thinking way far out?
Oh no, we've been able to buy that data for a long time. So, when you're on the healthcare, analytics side, there's all range of sources of data that you can purchase, and that consumer data from rewards cards is out and readily available for purchase through a number of different organizations. So certainly if you're using your pharmacy rewards card and and someone's buying cigarettes, because some of them still sell cigarettes, or alcohol, like that definitely, or your grocery bill, I mean, it definitely follows along with you and can be used, from a, sort of a risk assessment perspective to understand sort of what risk do you really provide. And I think there's concerns, certainly, and this, I heard these concerns as we, interviewed physicians, as we were talking about these different sources of data, and they were really concerned about, like, what if I get enough information that now someone is, I see that they have substance abuse, like I'm obligated to do something about that, but yet they haven't disclosed that to me. And so how, when I'm getting sort of, risks disclosed by a source other than the person themselves is concerning. There's lots of there's actually surveys that have been done that have been sort of really helpful in an interesting way. There was surveys that were done, assessments that were done for solar panel use. And so there's really, really strong residential information from those sources. And the way that can be used, sometimes when you're looking at, when you're trying to make a determination as to whether there's food deserts or whether people might have transportation barriers, and you're trying to understand sort of, how, rural or urban, it's zip code level information is available at the federal level. So you can get all sorts of free, data, not personally identifiable, but zip code level data that can help you when you're doing different analyses. But you can also purchase some that's more specific. And one of those sources is actually from sort of solar assessments, and it gave you better data about like tenement buildings and other sources that you can factor in that gives you a little bit more insight into sort of a town makeup, and where people may or may not have access to transportation.
That's fascinating.
That's scary.
Solar data. Like
Orwellian, yeah.
Yeah, it is, right? Very much so.
Well, go ahead, Kristy. I'll ask my question when you're done.
No, I was just going to say, so if you have all of this, so back to when you were talking about the in-home devices and people going home instead of being in the hospital, which actually, I really love that on a lot of personal levels, right? I think that would be really, really good for people. But I assume that those devices have to connect to my home Wi-Fi. So if my mom was sick and I had her in my living room and she's living there and I'm taking care of her with all of these devices, I would assume that has to connect to my home Wi-Fi. Is there a risk there as far as like hacking or anything like that? Like,
you just took my question, but yeah, I was just thinking that. I'm like, wait a minute.
Yeah, it's why, there's been a lot of, a push for secure home networks, to not just for, biohacking, but sort of hacking in general. Wow. And, so biohacking being, one concern is I can actually get, if I have an implantable device, right? Because people have implantable devices too that can actually be, I can have, a device to manage my arrhythmia, and it can actually be remotely tuned. Well, there's a concern that when you do have some of these implantables, right, that someone could actually go in, nefariously. Not that that's ever been recorded, but that obviously is a concern. And I think an extreme case, a fringe case, right, an edge case that you might use to prove a point as you're sort of defining rules from an ethics perspective and also from a security perspective, what you need to consider. But home networks are absolutely, any of the devices. I mean, we've been concerned about, our Alexa or, the Google Pod or our refrigerator or, our Nest thermostats or any of those devices, making sure that you have secure home networks, and at all possible home VPN to help to protect and shield that, so that information is transmitted more securely. Now, certainly the devices themselves often have secure transmission, and certainly FDA approved devices. There's much more, from a regulatory oversight perspective when it's FDA approved. But to your point, the home networks still should be considered. Oftentimes, what many organizations do is they give you sort of a dedicated phone that you would connect to, as opposed to sending it over your broad Wi-Fi, so that they can assure that secure connection and dedicated connection. But in many, in lots of communities, there's still Wi-Fi still cell phone challenges, and so you do have to consider what, where all different pockets around the country, how you might have to manage it alternatively.
That was going to be my follow-up question to that, and thinking about the rural areas that do not have access to some of these technologies, right? I mean, what does that look like in being able to transmit that information? But to your point, it sounds like hospitals will send a phone or send a device so that information does get transmitted.
And some of those places are just ruled out in terms of the ability to be included in a program like that because of it. So if you need instant transmission of data, it's probably not what you're going to do if you really don't have cell phone access or any type of high-speed internet access. One of the devices we used in the past, they did test it on Native American reservations. There wasn't connectivity, so it could store up to 30 days of data on the device itself. And the same, with my Aura Ring, each one has sort of a certain amount of time that it can actually store native to that device before it needs to be transmitted. So it can store and sort of forward once it gets into cell phone range. But there's a limit to which it can. And again, depending upon the time sensitivity of some of the data, that might not be an option.
Until we were talking earlier, I didn't even make that connection or realization of the legality of some of it. Legality meaning I'm transmitting information. There could be a diagnosis that is critical based on the data points I'm sending. Therefore, if a medical staff is not responding in a timely manner, like what do those thresholds look like? And then is the medical establishment on the hook if something happened, right? If I had a heart attack or I went septic. I mean, I hadn't thought about it from that end. Wow, there's a lot to uncover here.
Yeah. Are there any regulations around that kind of thing yet?
Not that I know of. I think some of it is in the disclosure to individuals. So in different programs I've seen where they've said, look, we look at this from a trending perspective. We're not an acute monitoring. And so if basically same thing, like if you have any symptoms, call 911, right? And so sometimes that they've been able to overcome that in terms of the rollout communication of the program and setting appropriate expectations up front, making sure people, sign, maybe read the terms and conditions and sign and agree beforehand. But each organization, I think handles it a little bit differently and has worked with their legal teams to make sure that they feel like they're adequately covered. But it's not something that you just jump into. You really have to make sure that you understand and that the patients that you're working with have a fulsome understanding as well.
So we're back to, I can give it up and it might get sold for nefarious purposes, but I can also give it up and there may be a value there that's greater than taking the risk of having somebody use it for some kind of sinister information gathering and targeting or something like that. And I don't know, just like the last one, I'm more on the side of, gosh, I want this data to be available to my provider. If she gets some kind of great information out of what I eat every day and how many steps I walk, then I just feel like there's more benefit there than there is risk.
The word sinister.
Yeah, so one, terribly sad situation that occurred, and actually just kind of the court case just finished up is, so I mentioned I use Garmin, I upload my data to Strava, and there was a pretty famous case of a professional bicycle racer, Mo Wilson and Mariah Wilson, who was from Vermont, and someone tracked her and actually used her Strava data to geolocate her, and then went up and confronted her and unfortunately killed her. And so it is, you are broadcasting your data, and they were able to, because they were able to get the sort of the digital footprint from her car where she had traveled, and all of actually seeing that she had pinged the woman's Strava. They knew, that was some of the evidence that was introduced into the case. So it is important to think about, to whom are you broadcasting this? How widely, how much are these individual organizations safeguarding your information or not? Big difference between consumer wearables and FDA approved devices. And so obviously some of the big commercial product companies have to safeguard your information. It's, it's only in their best interest to do so. But as I learned in high school law class, caveat emptor, like let the buyer beware. So
true. Good way to close it out, Heather. Well, thank you so much. That is all the time we have today. But Heather, you have survived the hot seat rather well, I would say. And I would just offer to anybody out there watching, if you think you have what it takes to be in the hot seat, let us know. We would absolutely love to hear from you. That's your ITHS episode for today. Thanks so much for being with us this week. I'm Kristy Tupper.
And I'm Jody Spencer. Tune in next time for some different faces, topics, and perspectives as we put someone else in the hot seat.